Hey Bio20s, I'm back again for another video. Today is going to be our last video in the Chapter 10 series. We are going to talk a little bit about blood pressure, and we're going to play doctor a little bit and talk about some cardiac disorders and problems you can have with your heart or your blood vessels. So, to get going here, what is blood pressure? Blood pressure is simply just the force of blood on the walls of the arteries. Remember, we would measure blood pressure in the arteries because the arteries are our high pressure blood vessels, okay? Veins would be much, much lower pressure. So when we're measuring our blood pressure, we're only measuring the force of blood as it pushes against the walls of the arteries. Remember, the arteries are nice and elastic and muscular and can stretch to accommodate that surge of blood. Now, two factors that will determine your blood pressure. So two factors that are going to help us determine blood pressure. We have cardiac output. This is simply the amount of blood that flows from the heart per minute. It's the amount of blood that is pumped out of the heart per minute. This is determined by stroke volume and heart rate. So what you would do is if you were to calculate the cardiac output, you would multiply the stroke volume by the heart rate. Essentially, how much blood is being pumped out of the heart and how many times is the heart beating per minute. You multiply those two factors together, you'll get your total cardiac output, which once again is the total amount of blood flowing from the heart per minute. The second factor that can affect blood pressure is arterial resistance. Remember, the diameter of the arterioles can change. These would be the smaller arteries, right? Arteries branching off into arterioles. So, as the diameters change due to hormonal responses from your hormones, from nervous system responses, remember they can be vasoconstriction or vasodilation. As the diameter changes, so too does your blood pressure, right? Because obviously, if it's smaller or wider, can affect your blood pressure. So the diameter also adjusts in response to metabolic products. For example, the breakdown of glucose can change the diameter of your arterioles. Now, let's talk about systolic and diastolic. So if any of you have ever taken your blood pressure before, maybe at a doctor's office, you can do it for free at like Walmart or Superstore or most pharmacies. You'll get two numbers. You'll get a top number and a bottom number, all right? That top number is usually, well, it should be higher than the bottom number. And they're both measured in millimeters of mercury. So that top number we call systolic or systole. So systolic is the highest blood pressure you'll have. It's when the ventricles are contracting. So a ventricular contraction, pushing blood out of the heart into the arteries, would give you your systolic number. Normally, it's about 120 or less. So you're shooting for about 120. Obviously, things can change in terms of blood pressure, right? Some people generally have higher blood pressure naturally, just genetically. Diet and exercise can play a role into it. Age can play a role into it. A lot of different factors can play out. Stress, right? A lot of different factors can play a role into your blood pressure. Now, that bottom number is known as your diastolic pressure, which is ventricular relaxation. So when the ventricles relax and fill up with blood, that's going to be the second number, usually around 80. So in terms of blood pressure, you're looking at about 120 over 80. Somewhere around there is a healthy blood pressure to have. Now, obviously that can change, right? If you just ate food, your blood pressure is going to change. If you did something physically active, your blood pressure is going to change. So just generally sitting, relaxing could differ from doing other things. That could obviously change your blood pressure from situation to situation. So how you would check your blood pressure is nowadays they have these fancy machines. You literally just put the blood pressure cuff on your arm, it squeezes for a few seconds, and then it measures the two blood pressures. Now what they would do in the past is they would actually get one of these here. They get a stethoscope, and the doctor would put it right here, kind of on your elbow, where your elbow bends, the inner part of your elbow, and then they'd wrap the blood pressure cuff around your elbow. So when they wrap the cuff around, they pump it up, pump it up, pump it up, and what would happen is they pump it up until they couldn't hear your pulse anymore, and then they'd slowly release the air and the pressure. And when they heard your first thump, your pulse, that would be your systolic number. And when they heard the second, that would be your diastolic. So that's the old school way of taking your blood pressure. Nowadays, you just do a quick machine. Once like I said, Shoppers, Superstore, most grocery stores have this, pharmacies, you go to the doctor's office, you can just do a quick blood pressure test to make sure everything's all good. So, one more time. Top number is your systolic, ventricular contraction. Bottom number is your diastolic, ventricular relaxation. Okay, if we look at pressure in terms of your blood vessels, most pressure is obviously in your arteries, then arterioles, capillaries, venules, and veins. So we know that arteries have high pressure, veins have low pressure, and obviously the closer to the heart you are, the higher the pressure it would be. Now, let's talk a little bit about cardiac disorders. So what happens when something goes wrong with your cardiovascular system? What are some diseases and disorders you could have? Well, we can have hypertension, right? And hypertension is essentially just high blood pressure, right? It's high blood pressure. You've higher than normal blood pressure, putting excess strain on your arteries and your blood vessels. It's often called the silent killer because you don't know you have hypertension unless you are checking your blood pressure regularly. Otherwise, you really wouldn't know if you have a blood pressure issue or not. Now, what could happen if you have consistent hypertension? Well, we can weaken the blood vessels and they might even rupture as well. So this is a really tough thing on your blood vessels. The higher pressure, the higher stress, it makes them weaker. It could even rupture an artery, which is not good at all. So hypertension, once again, is just high blood pressure. Now, once again, it's called the silent killer because you really wouldn't know something's wrong until, unfortunately, you have a stroke or a heart attack. Those are usually signs saying, hey, something's up, your blood pressure is crazy high. And that's probably not the warning sign you want. And we'll talk about strokes and heart attacks in a second. Now, what causes hypertension? Dietary factors such as too much salt, different environmental factors can play a role into it as well, causing your blood pressure to rise and work harder, and then also genetics as well. Some people just naturally have higher blood pressure due to a family history of having high blood pressure. Now, that doesn't mean it's okay, right? Just because you have high blood pressure and I'm eating right and I still have high blood pressure, you have to make sure that you manage that blood pressure so it doesn't get into a dangerous range where you're putting yourself at risk of a heart attack or a stroke. So, what else could go wrong here? Well, we have another disorder called atherosclerosis. Now, what this is, or arteriosclerosis, either way you want to say it, it's a degeneration of blood vessels caused by a fatty buildup. So, in a nutshell, it's a clogged artery. So when you eat too much fat or foods high in fat, that fat builds up in your arteries and it forms these little plaques, these little blockages. And over time, various arteries around the body can be blocked up because of these fatty deposits. It makes your heart work harder, increases your blood pressure, all of these different things can be attributed to this buildup of this fatty plaques. Then we have an aneurysm. An aneurysm is just a bulge in a weakened wall of a blood vessel, usually an artery. So what might happen with an aneurysm? It's a bulge or essentially a burst within a artery. And it could happen anywhere in the body, right? You may have heard of a brain aneurysm before, or an aneurysm somewhere else in the body. So it's just that kind of, if the blood vessel has been weakened, and then you get that bulge within that weakened blood vessel. Regulating blood pressure. So how do we actually regulate blood pressure? Couple things here. We have high and low blood pressure. Okay, they can be very serious problems, right? Hypertension, and then of course not getting enough blood to important organs like the brain, muscles, things like that. So we have special blood pressure receptors in the aorta as well as the carotid arteries, and they are very sensitive to high blood pressure. So if your blood pressure gets too high, these receptors, just like your chemoreceptors in your respiratory system, will act and then switch things up accordingly. So if your blood pressure is too high, your body needs to adjust to that, your circulatory system needs to adjust to that, your cardiac or your heart needs to adjust to that as well. If the pressure is unacceptable, so it exceeds an acceptable level, the medulla oblongata decreases the impulse and increases the relaxation impulse. So here's what's happening. Basically, your blood pressure is too high, so your blood pressure is very, very high. What's going to happen is a nerve impulse is going to decrease the stress response and increase the relaxation or de-stress response. This is going to decrease your heart rate, hopefully your stroke volume, and overall your cardiac output. So you're trying to lower your heart rate, lower your blood pressure by lowering your heart rate, lowering your stroke volume, lowering your cardiac output. And that's controlled by your nervous system. So the nervous system will get a signal from those receptors and then try and slow down and reduce your blood pressure. Okay? The opposite will happen as well. So let's say your blood pressure is too low, then we'll have a reverse. We'll have those receptors detecting, hey, your blood pressure is too low, signal sent to your heart to increase your heart rate, increase your stroke volume, and increase your cardiac output. Also, you might do some vasoconstriction, vasodilation, depending on the situation, to affect your blood pressure. Oh, sorry. And one final thing before we end here, I did mention I talked about a stroke or a heart attack. So with a heart attack or a stroke, just backing up here to the clogged artery slide, let's say the artery that you clog is your coronary artery. So let's say you clog that coronary artery. What that would do is it would prevent oxygen and blood and nutrients from going to the heart muscle itself. Now the heart cells start to die, and if your heart is having trouble beating, it goes into a kind of fight or flight mode, so it's trying to work harder and harder and harder, but blood and oxygen aren't getting to those cells. And as heart cells start to die, you might enter into a state of cardiac arrest. And what you'll need to do is immediately seek medical attention to hopefully, there's special medication you can get to unblock that clog, get blood flowing in your heart again, hopefully. Another thing you can do is, people have said that chewing aspirin can actually help with a heart attack as well, but number one thing is you call 911 or you get to a hospital and hopefully they can catch it in time. Another thing with a heart attack is if too much or too many of the heart cells die, they're not going to be repaired as well, so they won't be able to make new heart cells, so your heart could be permanently damaged from a heart attack. Sometimes you may have heard like a quadruple bypass, a triple bypass, things like that. What that would be is it's a special surgery where you're actually taking blood vessels, usually from your foot or some part of your body, you don't really need them, and you're bypassing the damaged or the clogged artery. So now blood can like bypass, it's like a highway. There's like a pile up on the highway, so you're doing a different route. You're taking a different route to get blood to the heart. Finally, a stroke is when blood is being blocked to the brain. So when blood is being blocked to the brain, now brain cells aren't getting enough oxygen and glucose, and they start dying as well. And depending on what part of the brain is affected, there could be some long-term effects to that as well, such as speech impairment, paralysis of the face, things like that. So that's it for today. So we discussed blood pressure, how you measure blood pressure, the difference between systole and diastole, and of course some cardiac disorders. So next lesson, we're going to be getting into chapter 11. We're going to talk about the types of blood. So we're going to talk about blood typing, we're going to talk about components of blood, what's in your blood, and then eventually leading on into the rest of chapter 11, which is your immune system. So enjoy the rest of your day, and we'll chat soon.